Hi, everyone, and welcome. My name is Cara Noble. I am the National Relationship Manager for CANSA for Service Programs, and I'd like to welcome all of you to our Let's Get Talking About Lung Cancer webinar sponsored by Roche. I would just like to thank the Roche team, specifically to Esnat and Zanele for all of their support, and I think more importantly for helping us put a focus on lung cancer. I think lung cancer in South Africa, it's a difficult topic to talk about. I think you'll see from some of the speakers we have tonight that it's definitely not something easy to go through, but unfortunately lung cancer does not get as enough attention as other cancers do. And we're just so happy as the Cancer Association to really be putting the voice of lung cancer patients out there, allowing the public to have a sneak peek into the lives of what lung cancer patients are going through, what their caregivers are experiencing, and just to share this information more widely. I think a lot of lung cancer patients don't often get the opportunity, or their caregivers, and we are so grateful that we have been really blessed with two wonderful ladies that are on our panel tonight. I'd really like to introduce you to them. I'd like to introduce you to Shireen Rampersad and her daughter, Sanrika Rampersad-Gilink, who are joining us tonight. Would you guys like to just share a bit more about yourself, please? We'll start with you, Shireen.
My name is Shireen Rampersad. I'm from Richards Bay. I have a non-small cell lung cancer, epidermal growth factor receptor with bone mets. I'm currently on Tasiba and Zometa. Previously, I was on chemo and radiation.
Okay, thank you so much, Shireen. And Sharika, sorry about your phone there. Would you like to introduce yourself to everyone?
Hi, I'm Sanrika Rampersad-Gilink. I'm married. I'm my mom's caregiver. And
it happens. Yes, please carry on, Shireen. Don't worry. Okay. Shireen, maybe let's start with you while we're just sorting that out. Shireen, tell us, how did you find out that you actually had lung cancer?
Okay, before I was diagnosed with lung cancer, I was admitted in Richards Bay Hospital for pneumonia.
Okay.
And I came out after 2 weeks, and my daughter was going to be registered in Newcastle College, my youngest daughter. And we traveled down that weekend to Newcastle, and Sunday, it was May 20th, I had a severe pain on my chest. And it felt like I was getting a heart attack. And I woke my husband up at 2 in the morning. And I told him, you know what, I think I'm dying. I'm having this heart attack. Please rush me to the hospital. And he said, no, don't worry, don't stress. I will take the car out and we will go to the hospital. I couldn't manage this pain. It was too excruciating. And I really thought I'm dying at that stage. And I told him, please, I don't want to die. And when we went to the ER, the doctor on call assessed me and he asked me, I had done x-rays previously. So I said to him, yes, I had been admitted in Richards Bay Hospital for pneumonia, and I was just released on that Friday. So he had run some tests, blood tests and x-rays, and he came back with the results. It was about 2:30, 2:45 in the morning. And he told me, does anyone have cancer in your family? So I said, yes, my late mom had cancer. So he said, you know what, which specialist do you want to see? So I said, okay, I was formerly from Newcastle. So I said, I would like to see my Dr. Maraj. And he had come in and he saw me and he did also a CT scan. And he said that there's a problem. I need to be transferred to Durban Hospital. And they have to do a biopsy and a bronchoscope on me. So 28th of May, I went to Durban Hospital and the doctor on call was there. And he said to me, he's going to do the bronchoscope immediately. So at 5, I was wheeled into theater and the doctor did the bronchoscope for me and the biopsy. So Tuesday, 29th, he comes into my ward and he tells me, Ms. Ramprasad, I got some good and bad news. So I said, okay, I'm prepared for whatever you have to say me, tell it. So he says me that the biopsy shows there's no traces of cancer. But when he did the bronchoscope from his side, he thinks it's cancer. But let's do a lobectomy and a thoracotomy. So I said, okay, it's not a problem. I'm prepared to do the procedure. So 2nd of June, I was going to theater, and before my procedure, they had done an induction on me, where all the doctors come in and they prep me, and then they had told me that I'll be on a ventilator, I will be on Kimby's, and I have to sign all the documents. And at that stage, I was quite frightened. So I said, this cannot happen to me. I don't want to be on the ventilator, and I don't want to end up in Kimby's. So at that stage, I changed into a different frame of mind. I said, I have to be positive in order to survive this operation, since I've been going through so many inductions. 2nd of June, they did the operation, the lobectomy, thoracotomy, and I was in CCU with tubes strapped around me, and the nurses were monitoring me and checking my oxygen levels, and I had this big bottles that were draining from my lungs. And when I saw that, I was very frightened. And he comes in and tells me that, Ms. Ramprasad, you've been diagnosed with lung cancer. And at that moment, I started to cry, because I didn't accept that I would be diagnosed with lung cancer. And in that same process, my family used to come and see me in CCU. And my youngest daughter, Shrivika, she just had finished matric that year. And she was being registered into the college, and I hid this information from her to tell her that I was diagnosed with lung cancer. Mm. And I had rehabilitation to start walking, and in that same process, my wound had burst open slightly. So I thought it was a normal procedure. I didn't know that it was a burst wound. And my doctor informed me that I have to see the oncologist here in Richards Bay after my recovery of the wound. Mm-hmm. So he gave me a number, and I had also done research, and I found my oncologist. Her name was Dr. Smita Abrahams. Mm-hmm. I found and I made a booking, and she saw me, and on the day when she saw me, she told me that it was stage 3 cancer, and I had to do chemo and radiation, and she had filled me with information about the treatment plan. She was very open, and she explained everything about cancer to me. Mm. And she introduced me to her team also. They were very helpful. The chemo treat, they always advised me on what to do and what not to do.
Shireen, sorry, I actually wanted to go back to something that you just said earlier. It almost sounds to me that when you are going through this process, it sounds like it's almost over nearly 2 months for you to get to a point of figuring out if you actually have a cancer diagnosis or not from your timeline. So I think that's something that people don't realize, especially with lung cancer, how challenging it is to always pick up, because it does get misdiagnosed with TB and pneumonia and other things. And if you look at the bronchoscope, it's actually a very common diagnostic tool. Yes, like that picked it up, but then the other procedure didn't. And I think this is why a lot of lung cancer patients are actually presenting quite late, due to the fact that some of the testing is coming clear. And I think this is where I'm just so grateful you had a doctor that followed his gut as such, because you had that feeling that something maybe wasn't right or wasn't there. So I think when you speak about Dr. Smita, and we know her well, she's also a partner of CANSA and a wonderful oncologist. How did that make you feel when you finally had like, okay, because obviously you're in these tests in and out, and like obviously those two procedures are quite invasive and difficult, and now you finally have a diagnosis. How did you feel finally putting like a label on all that you'd gone through and all the discomfort you've been feeling?
Okay, at the moment when I came to know that I was diagnosed with the cancer, I was very emotional. I was frustrated because I said, how could this happen to me? Because I was a person who did regular checkups. And how come did the doctor miss something like this? Because I always complained about chest pains and swelling of my hands and ankles. And it had shown on my x-ray, but nobody had seen it.
So were those your most common symptoms? Were there any other like more ongoing symptoms that you're experiencing that maybe afterwards you actually realized that maybe were connected to your cancer diagnosis?
I had lost some weight. I was vomiting, and when I vomited the first time, it was a pinkish color that I had vomited, and my hair was falling slightly. Those were my symptoms that I really experienced with the cancer at first stage. But when I was on chemo,
So it's very different, yeah.
Yes, it was completely different.
Yeah, and then Shireen, while we're on this topic of just discussing now, like you've just found out now, welcome back, Sanrika. I would just like to just speak to you as a caregiver and representing your family. What was it like for you as a family to hear the news about your mom, especially all the stress and trauma you guys had gone through and seeing her so unwell? I know she mentioned before you guys are visiting regularly and supporting, but that must have been quite difficult news to hear.
Yes, it was at first. We were all emotional. We decided first at the first stage not to tell my smaller sister because she wasn't staying with us. She was studying away from home. And we didn't want to get her emotionally stressed because we could deal with it, and we were worried about how she'll take it. She's very close to my mom also. But then we just had to be strong for my mom, be positive. We didn't treat it like it was like a illness. We just told her we carried on our normal day to day and kept things very positive at home.
I think that actually makes a big difference, because I think it's that sense of normalcy. It's a sense of like the same things you always did. If you had pizza on Wednesdays and if you play cards on Friday, you know what I mean? It's like whatever's your kind of family's sense of normal. I think that's really good advice, because I think, people have a cancer diagnosis, now they want to change their whole lives and they want to change everything. But they don't realize that for someone who has cancer, changing everything all at once, it's actually even more overwhelming.
Traumatic. Yes,
it's very traumatic, because now, you still want pizza on Wednesdays, you still want to kind of feel like your old person before your body is going through this. So I think that's something really good a lot of people can take away, because a lot of caregivers, out of love and the sense to help and love someone through it, tend to now change everything at once in the best interest of the patient. And we know sometimes patients get quite frustrated with not feeling part of things. I think that's a really wonderful thing that you guys did. Something else I want to speak to, Shreen, I know, Sanrika, we spoke about before, was how your family really came together in terms of I don't know if I can coin it, caregiver shift work, but wow, it sounded really incredible the way your family came together. I think, working with patients and myself as a social worker and representing a service team at CANSA, we're really aware of how many families and many patients are actually on their own. They don't really have a big support system, children overseas, children maybe in different provinces, and it's really not easy. So I was so in awe, and I'd love you just to share with everyone about your family's approach to having someone they love at home with cancer.
Okay, when my mom was diagnosed with cancer, I just got married in 2017, December 2017, and my mom was diagnosed with cancer in April 2018, April, May, and I was at home staying with her. So for my first year, I stayed with her, and I was full time with her during the day, and at evenings and weekends, my dad used to take over and give me a break. And my elder sister, she's a teacher. So during school holidays, she used to come up and take over looking after my mom.
Yeah.
So we all had our turn to take care of.
So important that everyone has a role to play, and that it just kind of works. It just sounds so seamless, like a well-oiled machine. Shireen, I would like to ask more about you now and your journey. How did you feel telling your family that you had cancer? Because obviously now you've gone through this, you've just heard it, you're trying to process yourself. But I think when you love people, and obviously I can see how much you love your family and how close you all are. How did that feel for you when you had to share that news?
I was very emotional because we come from a very close-knit family. And when they heard about my situation, my siblings were very concerned, and they were also emotional, and they couldn't sort of accept it because I used to keep the family together. Yet I was the youngest, and they supported me all the way through the treatment. My youngest daughter, I couldn't tell it to her because she was still like my baby, and I didn't know how to break the news to her. And she had found out from friends when they asked her, "How's your mom?" And she said, "No, my mom is fine." I said, "But isn't your mom have cancer?" And then she picked up the phone and she asked me, "Mom, is it true what I'm hearing?" So I said, "You know what? I will make a trip to Newcastle and I will tell it to you personally. Don't listen to what people have to say, and just be strong and positive." And it was a quite traumatic time for all of us because my husband couldn't cope with it. He was emotionally stressed out because we are very close, and he couldn't accept that I had cancer.
I think it's hard for anyone. It's even hard for you as a person just to accept you have cancer, and now you have this man who adores you. We know yesterday we were doing the dry run, how Shamil was making sure that everything was perfectly set up and that she looked wonderful and chatting with us from the back. We could already see, like, not even seeing him, how much love he had for you and how he was just so proud of you.
He was my best caregiver, I could say, because he did everything from preparing my meals, taking care of me. Some days I couldn't wake up. He would take me, bathe me, as Sandrika also used to do the same thing. Days I would be vomiting, sitting in the loo. They used to take me, bring me out, clean my mess. So it was quite difficult.
Yeah. I think the role of the caregiver is definitely not an easy one. I think this is why on this platform, I was so happy for the opportunity to actually represent both patient and caregiver, because I think both sides of the coin are so important. And actually, it's actually so sad, but I had two families pull out of this webinar over like a 1.5 week period, just due to the stress that the family was going through. And some unfortunate events. So we actually had a lovely lady, her name is Krista Mati. She actually used to work for CANSA before, and she was going to be on here representing her family as a caregiver and her dad, who has lung cancer. And she messaged me this morning and said, "Cara, I'm so incredibly sorry. My dad's taken a bad turn, and I just feel I would not be able to hold it together within the webinar, but I've sent a message that I would like you to share." So I'm just going to quickly read a message from WhatsApp that I received from Krista in her absence, just to yeah, just to honor her and what her family's going through. And I think it's important to know that cancer isn't always easy. I think being a social worker and having loved people that have had cancer and lost people that have cancer, both my parents have had, but they are still here, thank goodness. But it's really hard when you're working with families. You can see and you can empathize, and you see the frustration and the hopelessness and the hard things that families go through. And as cancer, the caregivers are just as important to us as the patients, because if you're just hearing Shireen speak, and you can hear how beautifully she speaks about her wonderful caregivers that she has in her life, I think you can just see the difference that when patients do actually have those people in their corner, we know they cope a lot better. We know things are just that much easier when they just have lots of love and support and kindness around them. It makes a massive difference. So just bear with me as I just read this message from Krista. It says, in 2002, Krista joined CANSA as a fundraiser and assisted with patient care as her town she lived in was really small. Back then, she thought she was untouchable. Cancer only happens to others, and her job is to support families going through the struggle and helping them cope. Never in a million years did she think that one day she'd be sitting on the other side, needing and asking for help and advice. Her dad was diagnosed in 2016. There were many ups and downs and lots of support received from the medical team and cancer. And then, wow, her mom was diagnosed too in 2019. Her dad is having a tough time with major side effects, losing weight and dealing with constant nausea following treatments, which is heartbreaking to watch. And Krista felt she was not able to join us tonight. What she did say, she said that as a caregiver, we don't ask for help. Because I asked her what is something that she wanted to share with others and with other caregivers. And I think it's always important that we end on a positive note, even though these are difficult conversations. And she said, as a caregiver, we don't always ask for help. We have this in the bag. We run our families day to day. We work, we cook, we get on with it. We say we are tired, but we keep on going. Being a caregiver is such an honor, but it's hard, but it's a hard reality, and it sucks. Cancer sucks. And right now, every day is a blessing and definitely not a given. So I think that's just a lovely short message from Krista. And I think it just gives you there's a little bit of insight into this wonderful woman and what she's going through with two parents that have cancer, and how she's really trying her best to be a wonderful daughter and to do what she can for them, even though this is a very difficult time for her. So yeah, I think, Senrika, I would really like to go back to you. And I know that you have painted quite a positive picture so far about how your family coped, etc. But what would you say was one of the hardest parts of being a caregiver to your mom?
The hardest parts were she just found out that she had that she was diagnosed with cancer, and she was still recovering from her op that she had. So that was the one, and taking her for her chemotherapy was the hardest.
Why?
Sitting there watching her getting all those drips, injections every week we used to go.
So okay, so then you took her to and from treatment.
Yes, I went with her every time.
Oh wow.
I feel you just have to have if the caregiver has a positive attitude towards it, it gives the patient a much more hope.
I could definitely agree, and I think there's definitely a lot of positivity, but I think it also must have been, I think that's what you just said now, is that reality of seeing her poked and prodded, and then seeing her uncomfortable, and then as family want to help and fix, and it's, I think sometimes I don't know, were there ever times that you felt a bit helpless or a bit overwhelmed, if you'd like to share with us?
Yes, there were a lot of times where we were helpless, because after her treatments there wasn't much that we could do for her. With her treatment and all, there wasn't a lot of medications that we could give her. We couldn't take to herbal treatments. So there was times where she was just suffering, and it was beyond our control.
I think that's so hard, and I think what makes it more difficult is that people cope in different ways. And do you know what I mean? So for example, Sanrika, it sounds like you are quite an upbeat, positive person. She also has the most magnificent pink ponytail, which means she's very confident and brave to have such gorgeous pink hair. But it doesn't mean that everyone is like that. Do you know what I mean? And I think
Yes.
I think in a family, I know I'm also quite a bubbly one. People are like, stop being so happy, so like irritating, like just calm down. But I know, Shame, I think when you're mentioning about Shamil earlier, Shireen, I think, Shame, that must have been really hard for you too. I think seeing the way he was almost like breaking because of your diagnosis. Would you like to chat a bit more about that?
When I got diagnosed, the lobectomy, as I mentioned earlier, I had a problem. It started oozing, and I had to be admitted in hospital, and I had to see another specialist. And after that, Sandrika, I had to clean the wound every day, and I was afraid that I thought the wound is going to be septic, that I'm going to die now. It was quite scary about it. And I approached Dr. Abrahams, and she told me, don't worry, everything is going to be fine. And once the wound heals, we're going to start the treatment. My husband, he was very emotional. He couldn't handle seeing me in that situation with suffering with pain. And also during that process, I ended up with infections in my throat. So it was quite devastating for me because I was irritated. And at that time, I couldn't eat properly too.
And I think a lot of people don't realize the link between lung cancer and eating issues and swallowing, and the swelling that happens in the area and the esophagus. I'm not too sure if you'd like to speak about that a bit more. I know now that you still are on active treatment and you still have some challenges. Would you maybe like just to share with everyone what's that like, still being on treatment, still carrying on every day?
Yes, previously before Tasiva, I was on chemotherapy for six months. I was on chemotherapy, and I had a lot of side effects with chemo. There used to be the nausea, the diarrhea, the ulcers, the throat sores, mouth sores. I couldn't eat. The smells triggered me. With radiation, I lost my complexion and my skin was burnt. And currently now I'm on the Tasiva. Tasiva had given me lots of side effects. There was rashes, severe diarrhea I had, severe vomiting, sores. My skin was very sensitive. I had to use non-scented fragrant things. The lotions had to be unscented. The bath had to be very cool baths that I have to have. Exposed to the sun also made the rashes worse and my skin flaked. The Zomata was to stop the lesions from growing and help the bone. But I also had a lot of pain with it, and I was on a lot of medication. And I also did take a lot of ginger with tea to help me control my pain. And the nausea with lemon juice I used to take. But at the moment, I cannot eat spicy food. Perfume triggers me. Cannot go out on the being exposed to sunlight. I'm constantly vomiting. But I'm on treatment for that. I take tablets. You cannot eat food.
And I think this is something where I think, it's, if you just, and it's such a cheesy thing to say, but if you look at you sitting there with a smile and being so brave and just sharing so openly from your heart with everyone here, it is actually crazy to think how much you're going through on a daily basis. And I think cancer, sometimes the way it's packaged is actually not correct, because patients are going through very difficult times every single day of the week. You might not be technically now on active treatment, but the side effects you're going through, what you actually is happening to your body is extremely overwhelming. And I think I'm just so grateful, Shireen, for your honesty that you can share here and be so open and be so honest, because sometimes people only want to see the good side of cancer. And yes, there is a good side of cancer. And I think the Cancer Association, to our support programs, to our education, and the way we support patients, we believe in that. We believe there's hope with every single cancer diagnosis. At the same time, though, I'm just so glad we have the opportunity to share the other side of things. And I think it's the really difficult side. And yeah, I'm just really grateful for your honesty. I think it might be an eye-opener to a lot of people here to think how, thinking of those range of side effects on a roll all day, depending what happens at 2 o'clock and 7 o'clock at night, when you go to bed in the morning. It's crazy to think how many things you have to cope with. And I think, wow, it's definitely a lot to go through. I wanted to ask you, of all the things you've experienced, Shireen, what do you think was the hardest part of everything, even through to today? What for you was possibly the hardest moment of your cancer journey?
My cancer journey, the hardest moment was when I had to go for treatment, and one stage, my husband was diagnosed with renal cancer. Mm-hmm. And I wasn't there to support him because it was COVID time. And he was wheeled in for surgery, and I had my treatment on the very same day.
Oh, my word.
And with COVID, you're not allowed to go and visit them in hospital. So the doctor did keep me posted about his situation. And I felt he was all the way there to support me during my time, and I couldn't do it for him. So it was a lot of anxiety, depression for me, because I wasn't there, like how he was a role model.
Wow. I actually can't even imagine that. That is just absolutely insane, that you're going through your own crazy journey, you're in pain, you're not well, and then the person you love the most, who's literally walked with you, is going through, wow, it was
like no support you had at that time, no family nearby you. It was just your kids, because my family is most in Newcastle and Danaus, and there was no one for us to give us that support. It was very difficult.
So it's almost like two different cancer stories, like in one family, where, like, yes, for example, through your journey, it was like very supportive and hands-on and different, and then it's almost as if your husband's journey was a little bit more lonely in terms of how he had to manage it, and stuff like that. Wow.
Yes.
So Sanrika, how was that for you guys? Wow, with your, like, as kids and stuff like that, and family, how was that for you to actually have both parents on treatment at the same time and going through cancer?
It was quite difficult at the start. My big sister, she was down here when my dad was going for his op, so she was here to help us out with his op, bringing him home, taking care of him. So she did more for my dad than I did for my dad.
Okay, but that's because your hands were full with your mom already. Not because you didn't do enough for your dad.
Yeah. So, and at that time they weren't using normally they both sleep in the same room, because my dad was so afraid that he'll give an infection to my mom, or he might hurt her. So they were sleeping in separate rooms, and he didn't want to hurt his operation. So he was also worried about him at the same time.
Oh, now that just sounds like madness. Yeah. All of it. But I think the most amazing thing is that here you guys are, and you are still here as a family. And wow, I think that's absolutely amazing. I think that is the hardest part of of a cancer diagnosis is the impact it has on the whole family. It's not only one person that's affected. Like everyone is affected in their own way, and everyone deals with it differently. I'm sure, Sanrik, you know me, for example, the way you dealt with it, and the way your sister, and the way your elder sister and your little sister. Do you know what I mean? Like, if you could compare, like, how were the approaches different, or how did you guys cope or like deal with the situation? Because, you know, different personalities, different ways of thinking. It doesn't mean you guys are all copy.
My elder sister and my smaller sister, they were much more emotional about it compared to me. They were, yeah, they were really stressed out about hearing my mom and dad having cancer. They didn't deal so well with it in the start. But now they're okay. Now they're positive.
Maybe you rubbed off on them. But do you think that it's your positivity, or what do you think made you see things a bit differently? Because you seem so constant and so like kind of like solid amongst the chaos. Why do you think maybe you maybe took it a bit differently?
I always wanted to be a nurse in the start, so I think that what rubbed off. So I had that nursing in me with them, and I didn't want to bring like any negativity around. I always wanted the place to be a positive vibe with them, because going through so much stress, dealing with that you have cancer and you have to take in everything. If you have no positivity, it's only going to give you a negative end of it.
And I think it also makes it like more overwhelming. I think when I read Krista's message and she said about caregivers asking for help. Are you someone that asked for help? Were you, you know what I mean? Was that something that you considered? Because it seems like you're just a soldier warrior that's going on. But
I never really took help from anyone.
Well,
I used to do my own research, like what my mom could eat, what she couldn't eat, try to look like for treatments that to make her feel much more better at home, remedies that I could give her, special food sometimes we had to cook because there were days where she didn't want to eat.
Definitely.
Yeah.
So you asked for help, but like not like for yourself.
No, not for myself.
Oh wow! So yeah, I think that's a typical wonderful caregiver. You are so worried about the patient that you don't worry about yourself.
Yeah.
Sure, but yeah, I think despite that, I think you really did an amazing job, and I think you might not have asked for help technically, but I think the fact that you had your family around you to support you as like this amazing unit of responsibility and sharing things, and yeah, I definitely think that made a massive difference. A lot of patients we know actually don't have such even a basic support system. And I think if you can imagine, I think, you know, from your both sisters to you and your dad, just imagine if there was only one of you for like all of it.
I think if it was just one, I don't think I would have coped, because there'll be so much things to take on. So it's good to have a support system.
Yeah, and I think that in many situations, people, you know, they say caregiver. I think people have very different perspectives. Some people think, oh, is it the nurse from the organization that's coming to assist me? Or no, it's like a nurse could be, a caregiver can be your neighbor. We have amazing neighbors that are fulfilling roles all over the country that are just absolutely magical. We have work colleagues. We have, you know, I think they're angels in people's lives that are fulfilling the role of caregiver, that are able to take them to and from treatment, that are helping them when they aren't well, cleaning wounds, all of those things. So I think caregivers are many people in different shapes and forms. A lot of people don't even realize they are caregivers, actually. That's also, you're just so busy getting on with it that you don't actually realize that, but you actually are a caregiver, because you are helping your mom on a daily basis to get through a cancer journey. And together you guys are like the power couple, which is amazing that you guys have each other, and it's really such a blessing. I wanted to ask Shireen, what inspired you, and what actually is inspiring you now, even though all you're going through, to keep on going? What is it? If you could share with us, I think a lot of people would like to know what is fueling this wonderful lady.
I think what kept me going was my family, the support they had given me, my kids, my husband. He was there 24/7, yet he was a lot of stress he had. My kids tried to make me very comfortable. My daughter from Escort, she sometimes make express trips and come down. Sandrika was there 24/7 by me cleaning up my mess, and I used to get angry, but she tolerated my anger. I should be very frustrated. I should blow up at her, and she handled everything. And for me to see what I had put them through, it really one stage depressed me, because I said I should be doing it for my kids, not for them to do for me. And it was very emotional, because there were days I would be in severe pain. The pain is the one that is unbearable. You have shortness of breath. You can't even take a long walk. You couldn't even go out anywhere. So that was, say, family support is the most important thing, no matter what. The family, if they're willing to help you, you will conquer anything. And that's what I had. From my siblings to my in-laws, to everybody that supported me, even strangers, they all supported me. And that's what I said, I am going to fight this disease, and it must not control me. So be strong, be positive, clear-minded. Don't let fear set into you. Once you have fear in your body, it controls you, and that's how cancer takes in charge of your body.
I think it's that decision. And I think we say this as social workers, we say when the patient has made the decision that they are boss, then that's when we see them take on the journey compared to them being taken on a journey, like in terms of being the other way around. And I think it's so wonderful that you had your family as a source of inspiration. And I think the role they played is really, it's actually so incredible. And then I'd also like to ask Shireen, then, what do you think inspired you to keep on going? So yes, like your mom said, she had some moments where she was shouting at you, and there was maybe a lot of vomit at one time, and she didn't like the soup you make, so too many lumps in it. And do you know what I mean? It's one of those days, and it's just no one is frustrating, but you love her, and it's like, what kept you going on those like hard days? What inspired you to keep on going?
I just wanted them to have a longer life, let them see things. So even when she used to scold me, I'll just blow it off, and then I'll say, no, I'll go back to her in the next hour when she calms down. I just wanted them to live.
Yeah, and to share many more memories. And
yes, that's what we do now. We try to make more memories, like take trips as a family together.
So you
make them happy. To enjoy the moments together as a family.
It's almost like your family lost out on quite a bit of time, while all of this was happening.
Yes.
So you value that time together so much more now, which is wonderful, because I'm sure the photos of the past 2 years must be amazing, because you guys have been doing different things and outings, and yeah, I think that's a really wonderful and positive way to live going forward, and then I'd also just like one last thing. What is a message, Sandrika, that you have for any of the caregivers out there that are listening, that maybe are taking care of someone at home, and maybe are just hearing you and thinking, oh, you know what I mean? Like, is there any message you have for them could possibly encourage them or inspire them?
They just have to be calm, patient with whoever they're dealing with that's got cancer. It's going to take a lot of work. there's going to be your bad days, but maybe the next day will be even much more better. They'll be more happier. But you have to take your time with the patients. You just can't drastically change everything in the environment. You gotta take it day by day.
I think that's
And
really
if-
fair. Sorry,
if they, to have a good support group. Maybe they don't have somebody, like some people, maybe they don't have family, but if they got friends to help them, to talk to, it'll be best.
Thank you so much. And then Shireen, I know you did mention a little bit before, but when it comes to dealing with family that are caregivers and people that are loving you and taking care of you, what advice do you have for maybe some frustrated, unhappy patients out there that maybe are scolding their wonderful caregivers? What could you share just to maybe give them some insight on how you still loved your daughter even through your difficultness?
As a cancer patient, I would say they must be show some sympathy towards the caregiver, because the caregiver, end of the day, she's sacrificing her life, her time to come and look after a person suffering with cancer. And we must be patient with them, no matter we're dealing with our own illness. The caregiver is a very important person in our life. Without the caregiver, I think we wouldn't make it that far, because she's working 24/7, she's feeding you, she's cleaning your mess, and you're venting out your anger, but the caregiver wouldn't react to you. She sort of takes all that burden, and she has nobody to talk to. It's only you and the caregiver that at the end of the day are together. So a caregiver plays a very important role in cancer patients. So I feel people should be have some sympathy towards them.
I think that's really true. Something that also happens sometimes, that when people check in, they always check in on the patient only, and they don't ask like, how is Shakil doing, Shamil, or how is Sanrika doing? You know what I mean? Or your older daughter, they just say, how's Shireen? And it's always something we try to encourage, that for people supporting or caring about cancer patients and their families going through cancer, please check in on the caregivers too, because they need those sweet messages and like thinking about you and your mom today. Like, do you know what I mean? Did you have people like that, Sanrika, that were supporting you from like outside? Do you know what I mean? Like when you were going through this, that maybe encouraged you or in any way?
Yes, my aunts and my uncles used to always phone and check up on me. If I need anything, is everything going well? So we did have that support.
I definitely think that actually makes a difference, you know, to what you have to go through. So I think from my side, I would just like to thank Shireen and Sarika so much just for being so honest and so open and sharing a bit of your lives with us. I think not everyone is so willing to be as candid and as open. So thank you so very much. I really think the people, whatever their background is, if they're here for interest or have lung cancer or another kind of cancer, I think there's definitely something that can be taken away from so much of what you guys said. I know that we did say we have a bit of extra time now, so we would like to open up if there are any questions that we'd like to put into the chat box. I know Sharina said that they are happy to answer maybe 3 or 4. So if there are any questions, please put those through. We'll wait a couple of minutes, and then, yeah, we can actually answer some of those, which could be quite nice. If not, then that's okay as well. But yeah, I would love to give anyone here, if you can just put your hands up, then yes, you can actually just ask a question now if anyone on the floor would like to ask a question. If you go to, I think it's reactions, let me just double check. No.
Cara, if I can share, we haven't got any questions, but we've got some lovely comments of people, thank you, brave ladies, for sharing your incredible story. Thank you for being so brave and sharing deep experiences. Support is extremely important in surviving cancer. You are amazing. And we've had, thank you for, you're an amazingly strong lady, and your strength is an inspiration to others fighting cancer as well as families. So thank you. That's some lovely comments. So no questions yet.
No, I think those are absolutely wonderful. I'm so busy being with Shireen and Sarika, I'm not even looking at the comments. That's so lovely to hear that people have really felt that from today. And I think that's obviously the whole point of why we're here, is to share the patient story and what families are going through, and to give people just an insight of what a family with lung cancer is actually going through. So I think we'll wait to the moment or so. If there is nothing else, if anyone would like to ask, okay, I see Lorraine Govender, we have a hand up there. If you'd like to open your camera and ask a question, we'd love to hear from you. Lorraine, I saw your hand up there.
Okay, sorry, the host, I was needing the host to unmute me. Okay, thank you so much. Yeah, thank you to Shireen and the daughter for sharing the story. I would also like to hear, because I know Stabile recommended interviewing her. What was their experience with the Cancer Association in the region?
Stabile supported me a lot, because whenever I was being hospitalized, she was there to give me moral support. She kept on checking, phoning me and finding out how was my day, how was my treatment, if I need any help, assistance. She was quite a good person to me. That's how I met Stabile in the hospital when she came to visit a patient. And she walked up to me and she greeted me and she asked me, what's my name and what am I doing here? And we just sort of automatically clicked and started talking.
I think that's so wonderful to hear, because I think that's actually really what cancer is here to do. We're here to support and walk patients through their journey of cancer. I think, Lorraine, that's a very good question. And I'm so glad that Stabile could play such a wonderful role in your journey. We have some really wonderful staff that work for us. I'm not too sure if there's anything else, but then, yeah, then I'll just...
Laura, there was one more question that just came in from Zodwa, who's head of advocacy at CANSA, and she wanted to find out, where did you get your treatment? Was it private or public?
It was private. It was the... It was an IBM eye institution. It was run by Dr. Abraham Smita. She was my oncologist.
Okay, yes, yeah, it's a very well-known facility in Richards Bay. So yes, from my side, from CANSA, I'd like to thank Emmanuel and EP Digital. Just one more thank you to Roche for allowing us to put lung cancer patients in a public platform, in a public place, that let's get talking about lung cancer. I'm just so grateful again to Senrika and Shireen for opening your hearts and sharing with us in such an intimate way. And also to Krista, who couldn't be here. I think, yeah, a very difficult place to be in, but a very brave lady that, just like Senrika, is an incredible caregiver and loves her family so very much. So yeah, it was a real honor for me to spend this time with you guys and have you on the couch, literally, and and to chat with you. Thank you so much for this opportunity, and thank you also to Lucy from our marketing team and our service team, Sandra, for assisting us as well, and Khada. And yes, I hope everyone has a safe evening. Take care, good night, and don't forget, CANSA is here to support you. If you want any more help or advice, please go through to our website, www.cancer.org.za. We even actually have a lung cancer landing page now to assist you with more queries about lung cancer. So you do not have to go through this alone. We might not be able to help with every area of your need, but we will definitely try our best to assist you in some way. Thank you so much. Stay safe and take care.